Hello, guys. Here, Dr. Patrick Price again, the body detective. Now, let's talk about something that's very common today, and that's headaches. Since the beginning of time, I'm sure cavemen had headaches back then because they had spines, right? And I always like when someone asks me, "So, what kind of patients should we refer to you, Dr. Price?" I said, "Well, do you know anybody who has a spine?" I go, "Well, yes." I go, "Anyone's got a spine," because when you got a spine, this is what we're spine doctors. All right. So when you're working on the spine, all the issues come from there because all the nerves that come from the spine goes to all the organs and glands in your body. So like a water hose, you pinch the water hose and not all the water's coming out. That's just like a nerve. So if you have a bone pinching on a nerve, the organ is going to not be functioning 100%. Now, the question I always like to ask is how many, well, let's say this, what percentage of nerves carry pain signals? Anybody know this? I'm listening. Okay. So if you said 50% or 90%, you'd be wrong. The nerves in your body that deal with pain are only 20%, guys. 20%. You got this? The rest of your nerves are doing what? They're dealing with organ function, gland function, muscles and tendons and ligaments, all the functions of the body. So nerve signals are very small in the body. But then again, what's the first thing that motivates someone to see somebody is pain. Pain is a great motivator. And if someone has intense pain, they freak out and run to the ER, right? Well, the idea is if you have intense pain, a disc injury in your spine, and if anybody's ever had this, you'll know it's now I've never given birth to a child, but people say it's like having childbirth, the intense pain of a disc injury in your spine. And I would tell you, it is one being a martial artist and hurting every joint in my body. I've had multiple injuries in my lifetime. If in fact, if you look at my rap sheet on trauma, it's like a manual. It's a book. And learning to completely heal your bodies is a big deal. But when you look at pain, if you just kind of calm down when something hurts, especially like a disc, some kind of spinal injury, and don't rush off, because believe me, surgeons are ready to open you up at any time. When you go to a surgery for your spine, it is a major surgery, guys. And even though you may be out of pain, you're never the same again. Your body will function differently. And I'm not saying don't have surgery. If you have a 10 millimeter disc, which is a huge disc in your spine, you may need a surgery, right? But just because you have intense pain doesn't mean you need surgery. This is where you try chiropractic, acupuncture, massage, all the different type of therapies that are more natural so your body can heal itself. And let me tell you, most of you out here, if you just get past the pain in the first couple of days, weeks, if you will, you'll be just fine. I did. And I'll tell you, headaches, if you ever had headaches, as a kid, I had migraine headaches. And if anybody out there's had those are intense. It literally feels like a freight train is running through your head. If you look at the old medieval days, they showed a skull with like the hole in the skull, right? They said they were letting out the evil spirits. Okay. Well, when you have an intense migraine, it feels like if someone drilled a hole in your head, the pain would go away. Anybody out there know this one? I'll tell you, as a kid, I'm like, just put a hole in my head and let it out, whatever it is. And nothing really makes these things go away, even medications. But here's how I got introduced to chiropractic. My mother took me for probably 5 years or so, doctor, Louisiana, Texas, all around. They wanted to do an experimental brain surgery on me at some point, so I couldn't figure it out. And then my best friend, his dad was a chiropractor. We didn't know what that was back then. And they took me in there and he started adjusting the occiput atlas. He looked at the x-ray, he goes, here it is. He goes, it looks like he's had a fall on his head. And I was like, Mom said, yeah, he fell off the roof on his head when he's a kid. So if anybody out there wonders what's wrong with Dr. Price, yes, I did fall on my head as a kid. And so because of that, I jammed the atlas, it's like little wings up there, the first one, into the occiput. And so when he began adjusting me, it was like a miracle. My headaches began to go away. They didn't go all the way right away. It took some time for my spine to realign itself, but eventually the headaches all completely went away. So out there, when I have people come in with headaches, they can be more than just a spinal thing. But when you come in and you've got an intense headache, for sure, when you adjust that first bone and the occiput, there's a very specific that you don't see a lot. I'm going to show a video on this. It's a occiput adjustment, right? And let me tell you, it's so relieving. I love it when people do it to me, but not all doctors know how to do this adjustment. But when they do it to me, it is like life-changing. It's like you feel your eyes even clear up. You see clear out your eyes. Your intuitive abilities come back on, and you just feel alive again. You'd be surprised. Well, I just think about this. How many people who don't go and get their spine adjusted, they get freedom of motion and get that release, that relief of energy in the body again. Get your mind clear, because if your mind's not clear, a simple adjustment sometimes will make your brain feel like it comes right back on 110%. I know my mom at 92, sorry, mom, 92, it does that to her. I adjust her spine, her brain's back on again. So let me tell you about this case. They come in, we adjusted the occiput, they went away. A couple adjustments, doesn't take long with headaches usually. But what happened is the headaches came back and they got more intense. And so this made me look a little further. So those of you out there who have headaches, especially migraines, pay very close attention to this. Because I had one patient who didn't pay close attention to this later, and some very terrible things happened to her later. When you have an intense headache that adjustments do not relieve, these are usually hormonal, all right? And you say, okay, my hormones are out of balance. Well, you can simply do a saliva test, like a spit test, and see where your hormones are. We do these right in our office. You can go to the website and order the kits and mail them to your house, guys. It's very simple to do a hormone test. But what you'll find is this. Your liver, those two lobes of the liver, is your huge organ that detoxes the body. And so when you have like adrenal stress, adrenals, all those epinephrine going through your body, right? And norepinephrine going through your body, stress every day, 24/7. How do you think your body disposes of that? Your liver. All these hormones that are in your body, excess hormones, like women that are younger, you have excess estrogen, right? Your liver has to process these for you. So your liver does like 1,000 things a day. So if you find you're having headaches that just aren't going away, guess what you need to do? I tell people over and over, you need to, first of all, open the tubes, clean out the tubes with the oxy products, but you need liver and gallbladder flushes. Now, not everybody listens to me, of course, when I tell them these things. They just don't want to do it. But the ones who do, guess what happens? Their symptoms are gone. Their condition is gone. Because if you have all this excess stress hormones flooding through your body all the time, your liver is stressed. Your liver gets sluggish. And if your liver gets sluggish, it can't do its operations. Now the kidneys get under stress. The lymphatic system gets backed up. And if you have liver stress and your liver stays sluggish long enough and you get backed up lymphatics, this is where cancer can come from, because your body's not ridding itself of its toxins properly. Everybody listen to this? And one patient that refused to do liver flushes ended up getting lymphatic cancer years later. Because what? Now you can say, okay, it's not because of this, but it's really simple. Your lymphatic system helps your body stay vascular, helps get oxygen to all the areas. And things get backed up in your lymphatic system, you don't get oxygen to all the tissues, all the organs and glands and tissues in the body. Your system literally is like a jammed up log system. So if your tissues cannot get enough oxygen to them, your body has a survival rate. It needs to survive. So it starts turning like into a plant, all right? Plants don't need oxygen. What do they want? Carbon dioxide. What do? They feed off waste. And this is what a cancer cells begin to do. Your normal cells that live off oxygen will convert themselves over to living off non-oxygenated tissues, or let's say blood. They'll start living off the waste that's in the lymphatic system, and they will begin to prosper and grow. So to rid yourself and prevent these type of things from happening, guys, is to flush your liver and gallbladder many times and open that lymphatic system. That way, you know, you're getting all this fresh oxygen to all the tissues in the body. So guys, today, headaches, it may be very simple what needs to be done to you, but once again, you need someone to make sure they do a specific upper cervical adjustment. It is an occiput adjustment, an atlas adjustment. Gonstead techniques are great for this, and there's several others out there that I prefer. But let me tell you, your life will be much more happier without headaches. All right, guys, I'm here anytime. Go to the YouTube channel. Make sure you're subscribed to our channel. Ask me questions there, and I'll do my best to answer them the best way I can. Enjoy your day. I'm Dr. Patrick Price.